Florida Medical Association, helping physicians practice medicine.
Good afternoon. I'm Tim Stapleton, CEO of the Florida Medical Association. It's very important to both our physician leadership and staff of the FMA that you know that our work on the issues that affect medicine is year-round. And when the legislature meets in Tallahassee, we're here representing you and your profession every day. We know that your focus and top priority is on your patients, as it should be. So please rest assured that our focus and top priority is making sure that you can focus on patient care without the burden of worrying about the legislative process, which impacts you and your patients. We're here to protect you from harmful legislation and to aggressively advocate for improved healthcare in Florida. We listen to physicians from across the state in every specialty, to our physician leadership, and to our highly qualified lobbying team to make sure that physicians, above anyone else, have the most influential voice in the practice in how medicine is practiced in Florida. The legislative process in Tallahassee moves fast, and a lot can happen in an hour, not to mention a day, a week, or a month. My goal and the goal of our team with these video updates is to keep you current on all the issues that affect you so that you can stay up to date without sacrificing valuable time that could be spent on patient care. So right now we're wrapping up week 3 of the 2021 legislative session. I'm pleased to report that PPE legislation, which was introduced by the FMA, directing the Division of Emergency Management to maintain an inventory of PPE for disease-related emergencies and to have standing agreements for the purchase of PPE by healthcare providers during emergencies, passed unanimously through its first committees in both the House and Senate this week, and we'll continue to push this through to ensure that you always have PPE available to you. On your behalf, the FMA has also proposed COVID-19 liability protection to healthcare providers. The Senate took the step this week of combining the business and healthcare liability bills into one bill, but the House still maintains 2 different tracks, two separate liability bills, one for the business community and one for the healthcare community. So the House and Senate are going to have to negotiate on what the final product will be. And we're working very hard along with a coalition that includes the hospitals and the nursing homes so that the final liability protection bill that passes includes healthcare providers. On Wednesday, the Senate Health Policy Committee passed an amendment that significantly waters down the physician assistant bill that we've been very concerned about. The amendment that passed this week removes the provision that allows PAs to practice independently or autonomously, as they say. We still have concerns with this bill as it removes the 4-to-1 supervising ratio, but the amendment is a step in the right direction. Now we're expecting the House version, which still contains the autonomous practice provision, to be heard in its first committee next week, and we're working very hard to educate members of the committee and all legislators on the educational differences between physicians and physician assistants. You know, simply stated, you know, we believe in team-based healthcare, but we believe that physicians should be the leader of the team, and that you know, all mid-level providers need to be supervised by a physician. The Senate Healthcare Policy Committee also took up a bill that would correct the problems and ambiguities with last year's pelvic examination bill. There are some policy concerns on the House side, but we're working with members and staff on a compromise, and we're very hopeful that we can get a glitch bill passed this year that will correct the problems with last year's bill. So stay tuned. Next week, we anticipate that the optometry bill, which is a terrible bill, It's going to be heard in the first committee in the House next week. It's already passed one committee in the Senate. Now, this bill would allow optometrists to perform laser and eye surgery and expand their prescriptive authority. So again, broad scope expansion bill, very bad bill. And as with all scope of practice expansion attempts, the FMA is working to stop this very dangerous and harmful legislation. Once again, these are just the major issues that we're dealing with this week. The FMA's legislative team is actively tracking over 300 bills this session. That's 300. And the landscape changes almost daily with amendments being filed around the clock. So if you have any questions about a specific bill or the legislative process, please contact us and keep a lookout in FMA News for more updates. We'll be doing these updates on a weekly basis. I also want to add that the one thing that you can do to help us help you is join the FMA PAC. If you're concerned about the various scope expansion bills that are being pushed, there are bills that are being pushed by the optometrists, which I referenced earlier, the physician assistants, the nurses, and psychologists. The best thing that you can do is contribute to the FMA PAC. And you can do that right now by going to www.fmapac.org and click donate. So thank you very much. And as I said, we'll be providing you updates as week to week as things progress. And I hope that you have a great weekend.
Florida Medical Association, helping physicians practice medicine.